Women's health is often surrounded by myth, confusion, and silence. Today we are breaking that silence by exploring two conditions that affect millions worldwide: Polycystic Ovary Syndrome and Uterine Fibroids. We'll explore what they are, how they affect the body, how they are diagnosed, and the treatment options available. By the end, you'll not only understand the differences, but also feel empowered to recognize the signs and seek help when needed. Let's begin with PCOS. Polycystic Ovary Syndrome is a hormonal disorder that affects how the ovaries function. Imagine the ovaries as tiny factories producing eggs each month. In PCOS, those factories don't run smoothly. Hormonal signals misfire, leading to irregular ovulation or sometimes no ovulation at all. The causes of PCOS are complex. Genetics play a role as well as lifestyle factors. Insulin resistance is a major driver, whereby when the body struggles to use insulin effectively, it triggers a cascade of hormonal imbalances. This leads to higher levels of androgen, the male hormones. In recent studies, some women experience irregular or absent periods, while others struggle with infertility. Other symptoms include weight gain, acne, excess hair growth, and thinning hair on the scalp. Emotional changes like anxiety and depression often accompany PCOS, making it not just a physical condition but a holistic health issue. There are 4 types and 4 phenotypes of PCOS, that is, insulin-resistant PCOS, inflammatory PCOS, post-pill PCOS, and adrenal PCOS. To understand all these types, watch our in-depth explainer on types of PCOS available in our Women's Health and Wellness playlist. By the way, PCOS is not about physical growth, it's about hormonal imbalance. Now, let's turn to fibroids. Unlike PCOS, fibroids are structural. They are non-cancerous tumors made of muscle tissue that grow in or around the uterus. Fibroids can vary dramatically in size, from tiny nodules barely detectable on ultrasound to large masses that distort the uterus. Their growth is influenced by estrogen and progesterone, which is why they often enlarge during productive years and shrink after menopause. By the way, many women experience heavy menstrual bleeding, while others feel pelvic pain, pressure, or bloating. Large fibroids can press on the bladder, causing frequent urination, or on the bowel, leading to constipation. There are 4 main types of fibroids, that is, intramural, submucosal, subserosal, and pedunculated. To understand all these types, explore our Women's Health and Wellness playlist and watch our in-depth explainer on fibroid types. Now that we've defined both conditions, let's compare them side by side. Firstly, PCOS is hormonal, while fibroids are structural. Secondly, PCOS affects the ovaries, while fibroids affects the uterus. Yet they share overlapping symptoms. Both can cause irregular bleeding, pelvic discomfort, and interfere with fertility. On the other hand, PCOS disrupts ovulation, while fibroids disrupt the uterine environment. Therefore, understanding these differences is key for proper diagnosis and treatment. Misunderstanding the difference can lead to frustration, delayed treatment, and unnecessary suffering. Next up is diagnosis. For PCOS, doctors rely on a combination of blood tests and imaging. Hormone levels are checked, while ultrasound often reveals multiple cysts on the ovaries, though not every woman with PCOS has visible cysts. On the other hand, diagnosis of fibroids is more straightforward. A pelvic exam may reveal an enlarged uterus using ultrasound or MRI, which can also pinpoint the size, number, and location of fibroids. By the way, treatment depends on the condition. For PCOS, management focuses on restoring hormonal balance through lifestyle changes such as diet, exercise, and weight management. Medications like birth control pills regulate cycles, while insulin-sensitizing drugs improve metabolic health. On the other hand, treatment of fibroids aims at the growth themselves. Medications can reduce bleeding and pain, as well as minimally invasive procedures, which shrinks fibroids by cutting off their blood supply. Myomectomy removes fibroids while preserving the uterus for women deserving fertility. Hysterectomy is only applied if fertility is not a concern. So far, we've discussed what the two conditions are, how they differ, their diagnosis, and treatment path. So, how do they impact fertility and quality of life? Actually, both conditions can challenge fertility, but in different ways. PCOS prevents ovulation, meaning the eggs will not be fertilized, while fibroids interferes with implantation or pregnancy progression. Large fibroids can block the fallopian tubes, distort the uterine cavity, or increase the risk of miscarriage. Beyond fertility, both conditions affect quality of life. PCOS brings metabolic risks like diabetes and cardiovascular disease, while fibroids bring physical burdens like anemia and chronic pain. In summary, PCOS and fibroids are distinct but impactful conditions. Understanding them is the first step towards effective management. Therefore, if you experience symptoms such as irregular cycles, heavy bleeding, or pelvic pain, consult a healthcare professional. Thanks for watching. My name is Skylar. If you have any questions or thoughts on PCOS and fibroids, drop them in the comments below. Stay curious, stay informed.